My name is Scott Sponholtz. I'm the Financial Aid Director at the KU Med Center, and we're going to talk about how to calculate the cost of financing an MD degree. And so we'll talk about what kind of aid is out there for you to apply for, free money, loans, work study. We'll also talk about maybe special circumstances that you have, maybe reasons why your degree might be a little more expensive. And then finally, we'll talk about some steps that you can take before you get to the Med Center to hopefully make that transition that much easier for you. So how much does this degree cost you? For the 2019-2020 school year, tuition is just a hair under $38,000 for Kansas residents and a little bit over $67,000 per year for non-Kansas residents. Tuition is finalized by the Kansas Board of Regents every year during the month of June. So we don't know what the amount will be for the 2020-21 school year yet. But tuition is only part of the equation. Students also pay campus fees. The campus fees allow you to use things like the recreation center. It pays for the wireless access, those sorts of things. So that's another $800 or so per year. And in Wichita, because they don't have a recreation center, the cost is $700, and then students can buy a pass to a local rec center for those types of services. Each year, there's also money allotted to buy books or supplies, so about $1,200 this first year. And then we also give students money for living expenses. So for 2019-20, we were giving students about $2,300 per month to live off of. So for your rent, your utilities, basic car maintenance, buying your gas and oil changes, buying things like health insurance. And with the living expenses, you can only get those for the months that you are enrolled in school. And so for first-year students, they're in school 10 months out of the year. There are opportunities over the summer between years 1 and 2 where a student could take an elective or something like that, or do research. And if you're getting academic credit for that, then you could get additional living expenses for a month or 2, depending on that activity that you're doing. But if you are not taking summer classes and you need your financial aid to stretch from July until June, you'd want to redo the math. So you're looking at more like $1,900 a month so that you have enough to cover your summer expenses. Second-year students are also in school 10 months. So again, you're not quite getting the full living expenses of a 12-month year. But once you start year 3 and extending into year 4, you're completing rotations year-round. So you're getting living expenses for all of that time. And then the cost of attendance also takes into account that if you're borrowing loans, there are what are called origination fees. And so those average about $400 per year. And so you get a little extra money to take into account for those. And if you're comparing the Med Center to other schools, we are doing pretty well for Kansas residents. So our residents pay right below public school residents around the country, so about $400 less. For non-resident students, at the moment, we're a little over $5,000 more per year for tuition than even a private school. So that is something that we are aware of. We are looking at trying to address that and try to minimize those types of tuition increases, because we know increasingly that's a burden to our non-resident students. And again, if you're looking also at the cost of attendance, Kansas residents, we are kind of right in line with public schools, and non-resident students, that cost of attendance, again, is a little higher than even private schools. In the closest data we have is from the 2018-19 school year to be able to make these comparisons. So if you're looking at the full 4 years, so again, that cost of attendance was for 1 year. With each year, you'll have different items depending on what's involved in that year. So second year, students will start studying for board exams. So you'll get some money to buy materials for that. In your third year, you're gonna also need some money to start studying for step 2 and to travel to the location for step 2. And then in your fourth year, you'll get extra money to go on residency interviews. So you'll get money to drive or take a plane and pay for hotels and food while you're trying to match with your residency location. And so over a 4-year period, Kansas residents, it costs a little over $270,000 for that full cost of attendance. In non-residents, it's almost $390,000. Some of those expenses certainly are out of your control. Tuition is assigned by the university. Living expenses, you have some choice on that. So if you can get a roommate or a couple of roommates, if you can cook your own meals instead of eating out as much, if you don't need a car to get around, there's some things that you could use to maybe lower the number below what we are estimating for all those 4 years. But do know that there is the option to get money up to that cost of attendance. So what kind of aid is available to pay for these expenses? In order to receive financial aid, the first step is to fill out the FAFSA, the Free Application for Federal Student Aid. That FAFSA comes out in October preceding the year that you're going to be attending. So students starting in fall of 2020 could have started filling out the FAFSA as early as October 1st of 2019. And anytime between October and then the following March 1st, all those students will be considered at the same time, and March 1 is our priority deadline. So there are some programs that are limited funded, and if you don't turn in the FAFSA by March 1st, you would not be considered for those limited funded programs. But the FAFSA is going to look at a student's income and assets, and if they're married, their spouse's income and assets. It does not look at parent income and assets because students are considered independent by nature of being in a professional program. There is an opportunity in a third or fourth year that a student could apply for something called a primary care loan. That particular loan would look at parent information, but again, that's not until years 3 or 4. You want to check with the school that you're applying at. All schools require the FAFSA in order to look at federal aid, but some schools for their own funds, so if they have scholarships or grants that the school has money for, they may have a separate form that they want you to fill out to look at your eligibility for those. And so when you fill out the FAFSA, and you go to fafsa.gov to do that, the FAFSA will determine what's called the expected family contribution. So they'll look at your income and assets and they'll assign a number to that. Let's say that number is $5,000 for your expected family contribution. They will subtract that EFC from the cost of attendance each year. And as you recall, the cost of attendance is for 1 year of tuition, living expenses, books and supplies, those sorts of things. And so let's say for an incoming resident student, that cost of attendance is $60,000. So they would take that $60,000 cost of attendance, subtract $5,000 of your family contribution, and that student would have $55,000 of positive financial need. So that could make them eligible for things like need-based scholarships, things like that, maybe federal work study. But even if somebody has no financial need, let's say Bill Gates decides he's tired of being a rich influencer and fighting global pandemics and those sorts of things, Bill Gates would have an expected family contribution of well over $60,000. Let's say his is almost $1 million. So when you take 60,000, subtract out $1 million, he would have negative financial needs. So he would have no financial needs. The good news is that with graduate and professional students, there is a lot of non-need-based aid. So he could still get some unsubsidized or Grad Plus loans to help pay for his education. So the good news is, generally speaking, most med students can get up to that full cost of attendance, and then the expected family contribution is going to look at maybe the quality of that financial aid, whether something is free money or maybe it's subsidized in terms of loans, something like that. So a couple of the types of aid that's out there. Many schools have their own scholarship programs, and the Med Center does as well. When students are admitted to the School of Med, it's kind of on a rolling basis. And so as they offer admissions to various groups of students, they will email you an application to the scholarship application form. And so they'll give you a deadline based on when you're admitted, and you write some essays, and then based on that one application, the School of Med will determine which of their scholarships they'd like to offer you. So you don't have to apply for individual scholarships, but you do one form, and then the School of Med will do the work to figure out what you would qualify for. You can certainly also apply for private scholarships, and the School of Medicine also makes students aware of outside scholarships that KU Med students have received in the past. So that way you can apply for those and see if that might be an option for you as well. KU also has a federal work study. And what federal work study allows you to do is to work a position on campus and get paid for the work that you perform. And with work study, it's based on financial need. So the FAFSA would have to say your expected family contribution is less than the cost of attendance. And work study helps you find a job because the government is going to pay 75% of your salary. And so departments only have to put in 25%, and they would much rather hire somebody where they're only paying 25% instead of having to pay the full amount. What I would caution you is to maybe talk to your academic advisor and find out what they would recommend in terms of how many hours to work each week. Med school is a pretty big change over undergraduate. And I understand that in some cases they take a semester's worth of information from undergrad and cover that in a month or shorter. And so the information's coming at you pretty quickly, and they have tests every 2 weeks. And I would not want you to work so many hours that you get behind, and then there's not enough time for you to get caught up with your schoolwork just because the information's coming at you so quickly. So talk with your academic advisor, see if they recommend maybe a moderate amount, maybe 10 hours a week your first semester or two, until you figure out how your study methods work and whether you have enough free time to be able to earn a little on the side to help pay for some of your living expenses. Another big area of financial aid is the Kansas Medical Student Loan. And this is something that is specific to the state of Kansas. So about 30 years ago, the state determined that we wanted to keep talented Kansas residents as practicing doctors and to make it affordable for them to be able to do so. So they created this Kansas Medical Student Loan Program. There's two versions of it. One is for primary care, and then the second version is for psychiatry. And so let me talk about what they have in common, and then I'll talk about specifics to each of the two programs. So both of the programs pay for your full tuition, and then it provides $2,000 a month in living stipends while you're in the program. And the only thing it does not cover would be your campus fee, which is $800 a year. It does not cover things like board exams, board study materials, books and supplies, residency interviews, those sorts of things. So depending on the year, there's maybe a $6,000 to $10,000 gap in the full cost of attendance that is not covered by the KMSL. And you would have the opportunity, if you want to borrow an additional loan for that extra $6,000 to $10,000 if you feel that you need that. What you agree to do with the KMSL is to match in one of the correct residency areas, and we'll talk for each program what those residency areas are, but you can match anywhere across the country. And then you agree after residency to come back and serve in high need areas of the state. So the only places that are excluded would be Johnson County, which is part of the Kansas City area, Douglas County, which is around Lawrence, Shawnee, which surrounds Topeka, and Sedgwick County, which surrounds Wichita. Every other county in the state, you do 1 year of service, you get 1 year of forgiveness on the KMSL. If that is not attractive as an option, you could serve at any of the VA hospitals in the state of Kansas. A year of service equals a year of forgiveness. You could also serve as a full-time faculty member at the Med Center. If you serve as a faculty member at the Kansas City campus or Salina campus, those are both allowable counties. So you do 1 year of service, you get 1 year of forgiveness. If you want to teach as a full-time faculty member down in the Wichita campus, because that's in Sedgwick County, which is excluded, you would have to do 2 years of full-time work to equal 1 year of service. The last option would be to serve at a clinic whose primary purpose is to serve financially indigent individuals. So an example I give is Grace Med. They have locations in Wichita, in Topeka, and some other places around the state. And normally, if you wanted to serve in Wichita or Topeka, that would not be allowed with KMS. But because Grace Med exists to serve low-income individuals, you can do 1 year of service and get 1 year of forgiveness through KMSL with that. So those are the things that they have in common. So what do they have that's different? So KMSL primary care is for students who are interested in any of these 4 areas. So you want to do a residency in family medicine, internal medicine, pediatrics, or emergency medicine. It doesn't matter, any of those 4 areas are allowable through the primary care program. So you don't have to say, I want to do pediatrics right now. If you change your mind and you want to do family med, that's still part of the primary care, and so you're still covered in that sense. And there's a separate program just for psychiatry. So if you're interested in psych or child psychiatry, those are allowable residencies and practice areas for that program. So each program has its own pot of money. You can't easily switch from primary care to psychiatry or vice versa. So take that in mind, that if you take one of those programs, that you are sure that you want to stay either in primary care or stay only in psych in order to make sure that you're in compliance with those programs. The primary care program has been around the longest, and the way that that program works is that we save 30 contracts for incoming students. We give first priority to Kansas residents who come from underserved areas, who graduate high school from kind of underserved areas, but we do allow out-of-state students to apply as well. They just are given kind of a lower priority versus in-state students. So we have 30 contracts for incoming students, and you can certainly apply for that and for a scholarship if you want from the university. But if you are offered both KMSL loan and you are offered a School of Medicine scholarship, you have to choose between those two. You can't have both of those. But it certainly makes sense to apply for both if you're interested. That gives you some time to potentially get offered both and then make a decision at that time. And I tell students, if you are offered a KMSL, to try to be as sure as you can. The reason for that is if you decide that the program is not for you. So you decide later on, hey, I met somebody in med school, they're from New York State, and that's where I'm going to live after I finish my MD degree. In that case, you go out of compliance, and the loan is 15% interest, and that goes back to the day that you received the loan. And at 15% interest, the amount that you borrow doubles in under 5 years. So that amount adds up really fast. Conversely, if you take the program and you decide, I really don't want to live in underserved areas of Kansas, again, you would go out of compliance for that. Or if you decide you took the primary care and you were thinking about doing family med, and later on you determine, I want to do psychiatry, now you're out of compliance with your primary care loans, because again, psychiatry is a separate program. It has its own pot of money and its own rules. With the primary care program, if you decide that you're not sure if you want to do that, or if it's not offered to you in your first year, we do have a retroactive process. And with the retroactive process, it allows students a second chance to potentially get into the program. So at the retroactive process, at that point, we give priority to fourth-year students. And the way that contracts become available for that is students approaching us during the school year and saying to us, I want to get out of this program. So they may give contracts back. Again, people may do rotations and determine, hey, I'm really not interested in pediatrics anymore. I want to do something else. I want to do radiology. With the retroactive process, we give priority to fourth-year students. So we give fourth year, third year, second year, first year. And you're free to apply, but your chances are best as a fourth-year student. Depending on how many contracts we have, we might be able to get students more than one contract. And what I mean by that is, let's say we had 20 contracts available and we had 5 fourth-year students. What we would do with those students is to cancel any fourth-year loans that they have so that they could get KMS in its place. And then we would work with them to help pay off third year, second year, first year loans that they have, and help them prioritize the ones that have the highest interest rate, so that what they're left with is mainly KMSL forgivable loans and minimizing what they may owe to the government or to a private lender for other types of loans that they would have. So that's how the retroactive process works. Moving to the KMSL psychiatry, that is a new program in 2019-20. We are in the second year of that program. And for that one, we only have 6 students who are able to receive that each year. And so it's a much smaller program. But again, it's a separate program. So if you take that one, it's only for students interested in psychiatry or child psychiatry. Because we have so few students that we're allowed to award, we do try to prioritize fourth year, third year students if possible. That way they can maximize how many forgiveness loans that they can get and help them minimize how much loans that they have through other lenders, essentially. So that is how the KMSL programs work. Some other programs that are similar to KMSL but are on a national level would be the Health Professions Scholarship Program from the Armed Services, the National Health Service Corps, and the Indian Health Service Corps. So they are very similar to KMSL. They generally pay tuition. They generally give you a living stipend. And for whatever they don't cover, you can potentially borrow loans for those. And they also ask for a year of service for a year of forgiveness. So for the Health Profession Scholarship Program, you do a year of service for one of the military branches. For the National Health Service Corps, think of it as KMSL, but for nationwide programs. So you're working at underserved areas across the country. And then the Indian Health Service Corps, you would be working on tribal sites to provide primary care for them. Some other aid that's available would be mainly loans. So the bad news about professional school is that there's not as much free money. The good news is that generally students can get up to the cost of attendance in their own name, not have to borrow loans using their parents. So starting with unsubsidized loans, those are available to students as long as you have not borrowed over $224,000 over your career. And those generally have some of the lower interest rates of all of these options. You can get a little over $42,000 for your first year and second year, and a little over $47,000 each year for years 3 and 4. And the only difference for those amounts has to do with how many months you're in school. And so again, in years 1 and 2, you're only in school 10 months out of the year. In the last 2 years, you're in school year-round. Whatever the unsubsidized loan does not cover, you have the option of applying for the federal Grad Plus loan. And the Grad Plus loan does not have an annual limit, except for it just fills the gap between the cost of attendance minus any other aid that you have. So if the cost of attendance was $60,000, the unsubsidized loan covered $42,000, you have an $18,000 gap, the Grad Plus could potentially fill that for you. The Grad Plus has a credit check, but it's only looking at red flags. It's looking at, have you declared bankruptcy in the last 5 years? Are you 90 days past due on a $2,000 or maybe $2,200 balance? If the answer to those are no, very high probability that you would get approved for the Grad Plus loan. Another federal loan is the primary care loan that I talked about earlier in the presentation. And this is available to 3rd and 4th year students. And for this particular loan, it would want to take into account family income and assets. The reason for that is this program wants to target students who come from potentially kind of a more disadvantaged background. And so in order to show that, that particular loan for many students will ask for parent income and assets in order to determine that. Depending on how much money we have each year, the primary care loan can be just to cover 4th year expenses. In some years, we have enough to do what's called the super primary care loan. And similar to KMSL, we might be able to help you repay other MD loans that you've received from 1st or 2nd or 3rd year through that primary care loan program. And the primary care loan is interest-free all the way until the end of residency. It has a 12-month grace period, and then it accrues interest at a fixed 5%. So it's a really good loan, and that interest-free during residency can really help for students with, $180,000 or $200,000 of loan debt. That can be $800 or $1,000 a month of interest that it's saving you, and it's also not requiring that you make payments during that time of residency. So it can be a huge benefit to you, and you can certainly make payments on it if you elect to, but you're not required to. But the primary care loan does require that you serve nationwide in primary care fields. And then lastly, on the private side, the KU Endowment Association, the fundraising part of KU, has a relatively small loan program to help students. It has a fixed 5% interest rate, and that does accrue while you're in school. And and then it has a 12-month grace period. And it charges 2% of what you borrow as a origination fee. The Endowment Association loan does not require a parent cosigner, so it's all in your name. You can borrow up to $6,000 per year and up to $24,000 over your KU career. So if you attended KU Lawrence or the Edwards campus and you borrowed endowment in the past, those amounts do count towards that $24,000 lifetime limit. And then some students will also borrow from other private lenders. So you can go to other companies, and it's possible you could get a better interest rate than you could from the federal government. Many of those private loans, the best rates are variable interest rates, and we're still at pretty historic lows for interest rates. So, try to keep in mind that, 4 years later, 8 years, 10 years later, are interest rates going to be as low as they are now? And if not, there are no caps on those variable interest rates. So, keep that in mind. Private lenders do offer fixed rate loans, but those tend to be pretty close to the federal loans. And so if the interest rates are pretty similar, I would maybe have you take a look at some of the benefits. Federal loans have many more repayment options. Some of the federal loans can be forgiven if you're involved in public service. So there are some reasons why federal loans may be more attractive than a private loan. And certainly debt is something that is a concern for med students. As you can see in the last 5 years or so, debt has increased well over 10% over that time. And it's hovering the last couple of years right around $180,000 for what students are borrowing just in the 4 years here at the Med Center. And so it's something we want to help you with. We offer some budgeting sessions to help students get a handle on their finances. We're happy to work with students one-on-one. Certainly, making sure that you meet deadlines for scholarships and things like that can help you keep those numbers as low as possible. But what you borrow at the Med Center is not always the full story. The Association of American Medical Colleges said that about a third of incoming students have debt from undergrad, whether that's from the federal government, whether that's to private lenders. But for those third of students, they average about 27,000. So now we're over 200,000 potentially of total debt. And then some students have other debt that's not part of their education. So maybe somebody has a mortgage or is making car payments, is paying off credit cards, and about 1 in 5 students have that, have those types of debt, and on average it's about 15,000 as well. So, many students are graduating with over $200,000 of debt, and med students do have the means to be able to pay that off, but it's not always easy, and certainly it's not something that we want you worried about. So one thing I want to talk about is some special circumstances. In some cases, when I tell students you can get around $60,000 per year for in-state students, in some cases they say, that's not enough, Scott. And so I can talk to them about budget adjustments. So these would allow us to increase that cost of attendance for certain categories. And in many cases, what the result then would be is increased eligibility to borrow a loan for these expenses. So we do allow students once per academic program to buy a computer or purchase other technology. So whether you want to buy a computer, a laptop, a tablet, monitor, software, what have you. And I guess I did misspeak. You are allowed to get up to $2,500 over your academic career. You can do multiple appeals as long as they are not for the same item. So I would say for med students, kind of the most common path would be someone purchases a laptop to use in years 1 and 2, and then maybe later on they want to get a tablet or something that they can just look up information instead of actually, typing up papers or something like that. So since the laptop and tablet are different types of technology, as long as they stay under $2,500 in total, we can do multiple appeals. Some students also have daycare needs, and so we do surveys every year to figure out what the average expenses are for infants and 1-year-olds and pre-K and that sort of thing. And so as long as you are spending less than what those averages are, we again can give you cost of attendance increases so that you can help pay for somebody to watch your kids so you can go to class and study. Other students have unusual medical expenses. Maybe they have really expensive medication that they take every month. Maybe unfortunately in the clinic they get a needle stick or get sick with something. So we give money as part of the cost of attendance for medical expenses. And let's say that's maybe $700 per year. So you would have to exceed that $700 threshold in order for us to increase those costs. So maybe if you had $1,000 of medical expenses, we take the 1,000 of paid expenses, subtract 700, and we could give you extra $300 to pay for that. The same principle is true for vehicle repairs. So we give, $700 or $800 per year for your car so that you can have gas and oil changes and basic maintenance. But if you had a big car repair that was $2,000, we would subtract out the $700 that we provided, and you would have an extra $1,300 that you could borrow in a loan for that. Please know that the Department of Ed does not allow us to cover car payments, so we can only help with car repairs. Another category that some students will approach us about is a income appeal. So when you're filling out the FAFSA, they're using tax information from 2 years prior. And so for many students and families, their financial situation has changed since then. And I know some students maybe take a gap year or two before they start med school. And so some students will approach us and say, Scott, I was making $40,000. I'm not going to be working at all in the MD program. Can I appeal to have the FAFSA look at that with my new information? The answer is yes, we can look at that. I would caution you to maybe approach us first. Most of the aid that is available to med students is not based on financial need. So for unsubsidized loans, Grad Plus loans, endowment, or private loans, all of those do not look at financial need. So whether you're making Bill Gates money or you didn't work at all the prior 2 years, you can still get the same amount through those programs. But if we're looking at something like a need-based scholarship or something like that, or primary care loan, then talk to us. And in some cases, what the expected family contribution is already pretty low based on your income. And so maybe if the government said your expected family contribution was $1,000, we might be able to lower that to zero, best case scenario. But depending on what you're wanting, that may not make a huge difference in making you eligible for that need-based scholarship. So School of Med may look at a $1,000 EFC the same as a zero, and in that case, it's not worth your time to turn in all that paperwork for the appeal. So if you talk to our office first, we can help you determine whether the appeal is something that might give you the outcome that you're looking for. All right, so I would be remiss if I didn't leave you with some steps that you can take to prepare yourself for the MD program. And a lot of them have to do with financial topics. So there are some areas that we are not allowed to help you through the financial aid office. And the two main ones that we see are credit card debt and loan and car payments. So if remember, we can help with car repairs. So if you have an older model car that keeps breaking down, every time it gets a repair, we can potentially help with that. But the government specifically says we cannot help with car payments. And I've had some students that with a car payment, maybe they're paying $400 a month, or maybe they have some credit card debt that they've been carrying with them. And now instead of trying to live off of $2,300 a month, which is what we provide for living expenses, they had a $400 car payment. Now they're trying to live off of $1,900, and so the math gets a little harder for them. So anything that you can do now, work some extra jobs, find a way to pay off that credit card debt. If you have a car payment, is there a way you can trade that for a car that you can pay for outright? So that way you have something that'll last you 4 years. If it's an older model car that needs more repairs, come to us, we can help with it, but don't have a car payment that is kind of an albatross for you and making it stressful to try to make your finances work. Now would be the time to start working on a budget. And I tell folks that it takes generally at least 3 months to develop a budget, and probably 6 months is a better estimate. It's easy for folks to figure out what those recurring monthly expenses are. Rent, utilities, maybe your grocery shopping is pretty regular. But over time, you'll uncover things like, oh my gosh, I didn't remember that in June, 5 of my family members all have birthdays. And so I need to start setting aside money each month to make sure I have some when June comes around. Or maybe it's your car tags or different types of insurance that maybe only get billed every 6 months or once a year. So the longer you give yourself, the more times you'll have to uncover some of these less regular expenses, build those into your budget, and then have something that's workable. And for some students, maybe you're fortunate enough that somebody was paying for your undergraduate program, and so you haven't had to budget. So starting now, trying to figure out what works for you, whether you're somebody who likes to do stuff electronically and keep track of your expenses that way. Do you like Excel spreadsheets, or do you want to do a cash-based system where you just take out money every week or every month and spend it out that way? Figuring out what works for you now will help you so that finances aren't such a learning curve in the MD program and you can focus on your studies. Certainly, our office is here to help, whether you are an incoming student, a current student, whether you're a couple years away. We're here to share information with you. We also bring guest speakers to campus to meet with current students. We've had financial planners meet for free one-on-one with students, and financial planners can help answer questions that our office is not an expert about. Buying a home, investing, paying taxes, things like that. We've had a professor at the KU Lawrence campus come and talk about investing in money management. We've had folks come and talk about insurance, whether that's renter's insurance, whether that's malpractice, or for students who might start their own practice, insurance that covers something like maybe even what we're dealing with now with COVID-19. What happens if something closes down your business for a period of time? There's some insurance that can help pay your staff's salary, so that way you can hopefully keep those folks, and then when that hopefully temporary situation passes, you can start your business back up and get on again. So don't hesitate. We're located in the Kansas City campus in Dykes Library, which is just north of the KU Hospital. And for students who attend the Wichita and Salina campuses, we come out at least once a semester to meet with folks face-to-face, and we're always available, calls or emails 8 to 5, Monday through Friday. So thank you for your interest, and we will talk to you soon. Thank you.